oils, capsules, topicals, and even CBD for pets. You don't want to miss 25% off. Use my link in the description below or my QR code right here or right here. And your coupon will automatically be applied at checkout. Thank you, Premium Jane, for sponsoring this video. And thank you for watching. Hi there. How are you today?
I'm well. How are you?
I'm good, thanks. My name is Dr. Matt. I'm going to do this exam on you. Let's go ahead and verify your first and last name and your date of birth.
Okay. Fallon Denby, 1/18/86.
Wonderful. I see here that you're a first-time patient.
Yes.
Okay. Before we begin, I just want to make sure that you're in for an annual physical exam, correct?
Yes.
Okay. And when was your last annual?
I think it was around this time last year.
Perfect. Okay. I'm going to go ahead and ask you a few questions. I want to make sure that I know your medical history and if you have any medical problems. Do you have allergies?
No, I do not.
Okay. So you're not allergic to any medications, no foods?
No.
Perfect. All right. Any history of hypertension, hyperlipidemia?
Hypertension in my family, but I do not have hypertension.
Okay. And is it from your father's side or your mother's side?
My mother's.
Any history of anxiety or depression?
Yes. Anxiety?
Okay. Are you taking any medications for that?
No, I'm not.
So you're able to keep it under control, right?
Yes. It's more of like a testing anxiety.
Okay. Do you have any sleeping problems?
No, ma'am.
Okay. And any kidney disease or respiratory problems?
No.
Perfect. Okay. Any injuries in the last 12 months?
Yes. I've actually been having problems with my knee.
Okay. So which knee is the problem?
The left knee.
Left. And tell me a little bit about what happened.
I'm not really sure how I aggravated it, but I noticed even stepping out of the car, putting pressure on it, maybe going up the stairs and down the stairs, it's really shaky, like I could possibly fall, and it's really painful.
When did it start?
I want to say like 3 months ago.
Okay. And is the pain intermittent? Does it come and go, or it's constant?
Right now it's been about a good week, but prior to that I was fine. Like,
okay.
So I would say come and go.
Okay.
So I'm sure I probably aggravated it in some way, and I'm just not sure. Maybe working out too much, maybe just something as far as getting out the car wrong. I'm not really quite sure.
Okay. On a scale of 0 to 10, how would you rate your pain?
I would say like a 8.
8 out of 10. And how would you describe it? Is it achy? Is it sharp? Is it dull?
It's like a shooting. Like once I put the pressure on it, it's like an instant, not a shock, but like a shooting pain sensation.
Okay. Any accidents in the last 12 months or so?
No.
Okay. Are you taking any medications on a daily basis?
No, I actually try to avoid those things unless it's prescribed. So I'm just more of a bite the pain type of person.
Okay. Well, it is okay for a pain of 8 out of 10 to take some medication, especially because you want to keep on walking and be able to do your daily activities. But it's your choice, of course. Okay. So let's go ahead and begin. Can you please tell me today's date?
What is today's date? I believe it is. It is. Oh my God, I'm having a brain fart. I'm so sorry.
That's okay.
It is the 25th of May.
Okay. Okay. And what last year?
I'm sorry?
The year.
2022. I'm sorry.
No worries. Okay. And do you remember my name?
Yes, Dr. Met.
Perfect. Okay. And today's nurse is Sleepyhead. Do you have any goals for today's visit?
Maybe just kind of have a better understanding of what's going on with my knee.
Okay. Okay. Perfect. Okay, so I'm just gonna go ahead and sanitize my hands. Are you having any headaches in the last 2 weeks or so?
No.
Okay. Any flu-like symptoms?
No.
Perfect. Any tingling sensations in your hands or your feet?
No, ma'am.
Any back pain?
No.
Perfect. So what I'm going to do is I'm going to palpate your head. Is that okay?
Yes.
I want to make sure that your head is symmetric, you're not having any lumps or anything abnormal.
Okay.
Okay? So go ahead and relax. Okay. Head is symmetric. I'm not noticing any abnormalities. Any pain when I palpate here behind the ear?
No.
Okay, great. And I'm going to check your neck and your lymph nodes. So go ahead and relax. And above the collarbone. Perfect. I'm also checking your thyroid gland. Can you please go ahead and swallow for me? Perfect. Thyroid gland is non-enlarged. I'm not feeling any nodules. Trachea is midline. And I'm not feeling any lymph node enlargement. Okay. Let's go ahead and check your temperature really quick. I'm going to put this inside your ear. Perfect. 98.9. I'm also going to take your oxygenation. I'm going to put this on your index finger. Go ahead and relax. Wonderful. Your heart rate is 75 beats per minute, which means that you're very relaxed. And your oxygenation is 97 percentile on room air. No lung problems. I'm going to take your blood pressure. Is that okay?
Yes.
Is it okay if we use this arm? Perfect. Okay, and with your other hand, is it okay if you hold this for me? Perfect, thank you. Excellent. Blood pressure is 125 over 77. It's perfect. Let's go ahead and slide this out. Excellent. Okay. And is it okay if I listen to your heart and your lungs?
Yes.
Great. Is it okay if I put the stethoscope underneath the shirt? Okay. Okay. So first I'm going to listen to your heart. Relax. Great. Okay, so I'm able to hear only S1 and S2, no S3, no S4, and now I'm going to listen with the bell. Same thing. Go ahead and relax. so I'm not able to hear any murmurs. I'm going to go ahead and listen to your lungs now. Please take a deep breath in and exhale. Good. One more time. Take a deep breath in and exhale. Good. And I'm going to put this right here on the side. Take a deep breath in and exhale. Good. Same thing on the other side. Take a deep breath in and exhale. Is it okay if I listen to the back as well?
Yes.
Okay, take a deep breath in and exhale. Good. One more time, take a deep breath in and exhale. Perfect. Again, take a deep breath in. Exhale. Very good. Take a deep breath in and exhale. Okay, very good. I'm just going to go ahead and write some of the results in. Okay, so what I'm going to do first is I'm going to palpate your face. Let me know if you feel any kind of pain. Okay, and I'm also inspecting your sinuses right underneath the eyes and above the eyebrows. I'm not feeling anything swollen. Okay, palpating your nose. Any pain when I do this?
No.
Any pain when I do this?
No.
Can you please breathe in, breathe out through your nose? Okay. Breathe in, breathe out through your nose. Perfect. So both nares are patent. Can you please relax your jaw? A little bit more. Perfect. Okay, good reflexes. Go ahead and close. And I'm palpating your jaw for any tenderness. Good. Can you please clench your jaw? Good. Keep it clenched. Relax. Okay. Clench it again. Very good. So I'm not feeling or hearing any clicking sounds. Good. Okay. And I'm going to slowly tap on your face again. Good. Okay, great. Okay, I'm going to check your facial sensation now. Can you please tell me if you feel this?
Yes.
You feel this?
Yes.
And do you feel this?
Yes.
Did you feel that equally on both sides?
Yes.
Okay. What I'm going to do now is called the sharp or dull test. Can you please extend your palm for me? Oh, perfect. So this is sharp and this is dull. So go ahead, close your eyes and tell me if you feel sharp or dull.
Sharp.
Good.
Sharp. Dull.
Good.
Dull. Oh, sharp.
That's okay.
Sharp.
Good.
Sharp. Dull. Dull.
Good.
Dull.
Good.
Dull.
Perfect. Okay, I'm going to take a measurement of your head circumference. Okay. Perfect. Okay, can you please give me a big smile? Great. Now frown. Right, puff your cheeks. Keep them puffed for me, please. Perfect. Go ahead and relax. Can you please sting with your tongue inside your perfect, yes, thank you. Excellent. Now go ahead and close your eyes. I'm gonna try to open them. Don't let me do that. And can you please open your eyes as wide as you can? I'm going to try to push down your eyebrows. Don't let me do that. Okay, go ahead and relax. And what I'm going to do now is I'm going to check your mouth. Any soreness, any lumps inside?
No.
Oh, great. Okay, so can you please give me a big Good, excellent. Move your tongue up and down for me, please. Perfect. Now side to side. Excellent. Perfect. Okay. We are required by the clinic to take a mouth swab. Is that okay?
Yes.
Okay. And I will have the results for you through the portal. And I think within 24 hours. Okay, so go ahead. Open your mouth. Just a small cheek swab. Good. Same thing on the other side. Good. Okay. So we're going to test your DNA for any genetic disorders. Make sure that we catch everything before it happens.
Okay.
Okay. Next thing, I would like to check your denture. Is that okay?
Yes.
Okay. So what I'm going to do is I'm going to slowly tap on each tooth individually. Please raise your hand if you feel any kind of pain, tenderness, or any sensitivity.
Okay.
Okay. Perfect. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and up. Perfect. Go ahead and close your eyes. Okay. So I wasn't able to notice any abnormalities. Gingiva is pink, no signs of infection, and I wasn't able to see any lumps either. Perfect. Okay. I'm gonna go ahead and do a quick eye exam. Are you noticing any blurry vision, double vision?
No.
Are you wearing contacts right now?
No, but I did get LASIK in 2013.
Oh, okay. Perfect. So let's go ahead and see if you have any changes in your vision.
Okay.
So first I'm going to ask you to look at my nose right here. Okay, and don't move your head. Try to keep focusing on my nose. Perfect. Same thing. Good. Can you please look down? Good. Keep on looking down. Perfect. And now look up for me. Good. Keep looking up. Perfect. Okay. Go ahead and, without moving your head, only your eyes, follow my finger. Okay? Perfect. Okay, go ahead, keep on looking down. Just go ahead and look up. Perfect. Excellent. Okay, so what I'm going to do now is I'm going to cover one eye for you. Go ahead and you cover it. Perfect. And can you please tell me when you don't see the light in your field of vision anymore?
Okay. I don't see it.
Okay?
I don't see it.
Perfect.
I don't see it.
Okay, let's go ahead and switch eyes.
I don't see it. I don't see it. I don't see it.
Excellent. Okay, go ahead and cover one eye again. Can you please tell me how many fingers I'm holding?
1,
Good.
2,
Good.
5,
Perfect. Let's go ahead and switch eyes.
5,
Good.
2,
Good.
4.
Perfect. Okay, with both eyes open, I'm going to ask you to tell me when you don't see my fingers in your field of vision. Okay?
Mm-hmm.
So I'm going to wiggle my fingers right here, very close to your eyes. Tell me when you don't see them.
Don't see them.
Good.
Don't see them.
Good.
Don't see them.
Good.
Don't see them.
Okay, perfect. cover one eye. And with the other hand, hold the Snellen chart. Perfect. Just a little bit farther. Extend your arm. Perfect. Can you please tell me what letter this is?
F.
Good. And what letter that is?
L.
Can you please read the last row starting with the letter L?
L, T, F, P, H.
Excellent. And what color is this?
Red.
And what color is this?
Green.
And what number do you see right here?
4.
Perfect. What number do you see here?
2.
And which circle is bigger, 2 or 4?
4.
Excellent. Let's go ahead and switch eyes. Okay. Can you please tell me what letter this is?
O.
Perfect. What letter is this?
C.
And what letter is this?
H.
Can you please read the last row starting with the letter H?
H, P, F, T, L.
Wonderful. And what color do you see here?
Green.
What number do you see here?
9.
And what number do you see here?
8.
And which circle is smaller, 8 or 9?
8.
Okay, perfect. Let's go ahead and check your color vision. Can you please tell me what number you see here?
12.
Perfect. Go ahead and cover one eye. What number do you see here?
6.
What about here?
8.
Okay, go ahead and switch.
29. 57.
Perfect. Okay, can you please trace this number for me with your finger? Excellent. Go ahead and switch eyes. Can you please trace this number? Okay. Can you please tell me what number this is?
5.
Good. What number do you see here?
I don't see a number.
Good. Can you please trace this line starting with here? Perfect. And now switch eyes to the same thing. Okay, perfect. No abnormalities there. Okay, so let's go ahead and check your ears next. Are you experiencing any pain, any hearing loss, any buzzing?
No, but I do notice, I feel like even though I clean my ears with a washcloth, that they still get a lot of wax in them.
Okay. Wax is very natural to happen, and it's the way your ears prevent any infections. So I know a lot of wax can be very uncomfortable, but I think that I'm going to take a look and let you know if I see anything abnormal.
Okay.
Alright, so let's go ahead and first just inspect. Can you please turn your head that way for me? Great. Go ahead and relax. Good. I'm not noticing any abnormalities. Any pain when I pull up?
No.
Any pain when I pull back?
No.
Perfect. I'm going to take a look inside with my otoscope. Okay. I'm not noticing any signs of infection. Just a normal amount of earwax. Tympanic membrane is pearl gray. Everything looks very good. Okay, go ahead and look that way for me. Go ahead and take a look inside.
Mm-hmm.
Tympanic membrane is pearl gray. Margins are very well defined. Just a normal amount of earwax. Everything looks very healthy. Okay, I'm gonna go ahead and check your hearing next with a tuning fork. I'm going to create a vibration sound. Can you please tell me when you don't feel the vibration anymore?
Okay. I don't feel it.
Can you hear it now?
Yes.
Excellent. And which position felt louder? Position number 1 or position number 2?
2.
Excellent. Okay.
I don't feel it anymore.
Can you hear it now?
Yes.
Excellent. And which position felt louder? Position number 1 or position number 2?
2.
Wonderful. Okay, keep your eyes closed. And can you please tell me with which ear you hear the sound? I'm just going to move your head to center. Perfect.
Left ear.
Good.
Right ear.
Good.
Both.
Okay. I'm going to cover one ear for you. Can you please tell me when you don't hear the sound anymore? So that's covering.
I don't hear it.
Good. Same thing on the other side.
I don't hear it.
Wonderful. I'm going to go ahead and whisper some words in your ears. Can you please repeat them back to me?
Okay.
Dr. Mad.
Dr. Mad.
I want my tingles back.
I want my tingles back.
ASMR.
ASMR.
Okay, perfect. Okay, so I'm gonna go ahead and check your taste first. I'm going to put 1 drop on your tongue. Can you please tell me what this tastes like?
Very sweet.
Okay, and can you pair it with something? Because it is specific. Let's go ahead and try that one more time.
Okay. It tastes like strawberries.
Okay, perfect. And I do have here one more. It's different, so go ahead and tell me what it tastes like.
Sour.
Okay.
Like candy, like a Sour Patch. Candy.
Perfect. Yes. Alright, can you please tell me what this smells like?
Coffee.
Perfect. So I'm not noticing any abnormalities there. I also want to take a look inside your nose just to make sure that there is no obstruction, but I'm most likely sure that there isn't. Okay. Nasal mucosa is pink and moist. And I'm not noticing any obstruction either. Okay. Is it okay if I have you lay on the table and I'm going to listen to your belly and do a thorough exam?
Yes.
Okay. Okay, Val. Are you comfortable?
Yes.
Perfect. So what I'm going to do is I'm going to listen to your belly first. Is it okay if I lift up the shirt up to here?
Yes.
Okay. Okay, perfect. I'm hearing only normal bowel sounds. I'm going to perform what's called percussion. So I'm going to slowly tap on your abdomen. Let me know if you feel any kind of pain. And I'm going to slowly palpate. Let me know if you feel any kind of pain. Okay, I'm feeling normal organ size. And I'm going to slowly tap on your chest. Let me know if you feel any kind of pain. Okay. Okay, I'm not noticing any edema. Skin is very well perfused. I'm going to check your pulse. Good. Good. And also capillary refill within 2 seconds. So that means very good peripheral circulation. No signs of any abnormal moles. Okay. Any pain when I palpate your hand?
No.
Great. Perfect. Okay, let's go ahead and check your other hand. I'm going to check your pulse. Plus, no signs of palmar erythema. Nail beds are intact. No splinter hemorrhages. And I'm also checking capillary refill, which is within 2 seconds. No edema. And no signs of any abnormal moles. Okay, so I'm going to go ahead and check your knee next. So I'm definitely noticing that your left knee is a little bit more swollen.
Yeah, that hurts a little bit when you do that.
Okay. So it's right above the kneecap.
Mm-hmm.
What I'm guessing is that your muscles were strained right here at the end, where the knee joint is uniting. Let me know if you feel any kind of pain, okay? Good. I'm just going to slowly lift up your knee. Perfect.
Yeah, see, when you do that, it's really tight.
Okay. So go ahead and relax. Okay. Normal reflexes. Okay, go ahead and relax. Okay. Also normal reflexes. Okay, so what I'm going to do is I'm going to send you for an x-ray of this knee. Make sure that nothing is broken, although the chances are very slim. And also I'm going to send you to an orthopedic doctor to take a look.
Okay.
Let's go ahead and check your feet next. No edema. Both legs resemble the same temperature. I'm going to go ahead and check your pedal pulses. Perfect. So 2+ and symmetric, synchronizing. going to take a look in between the toes to make sure that there is no fungal infection, which is very common. Everything looks very good. Okay. Can you please push with your pads? Good. And now push with your heels. Perfect. And now pull towards you, your feet. Perfect. Okay. I'm going to try to close your legs. Don't let me do that, okay? Good. And I'm going to try to open them. Don't let me do that. Perfect. I'm going to try to lift this leg up. Don't let me do that. Good. And I'm going to do the same thing on the other side. Don't let me do that. Perfect. Okay. Next, is it okay if I check your spine? Make sure that you have no signs of scoliosis?
Yes.
Okay, so let's go ahead and have you placed on your belly. Okay, I'm just gonna go ahead and move the head a little hair out of the way. And I'll start by palpating your cervical spine. Let me know if you feel any kind of pain. And I'm feeling each vertebrae going down to the thoracic part. So far I'm feeling only normal curvatures. They're not deviated to the left or the right. I'm not feeling any abnormalities. And paired with the fact that you have no back pain, that really is an indication of healthy spine. Okay, both hips are aligned. Perfect. So let's go ahead and discuss the results further. So everything looks very healthy, except for the knee. And like I told you, I'm just going to make a recommendation to see an orthopedist, a specialist, who will definitely tell you further actions that we should take with the knee. So far, I can order the x-ray and have you go there before you even make the appointment with the orthopedist.
Okay.
Okay. Do you have any questions for me?
No.
Wonderful. Thank you so much for choosing my clinic to do this exam on you today. And I'll see you back soon.
Thank you, Dr. May.
Thank you. All right, girl. So